Hi, welcome to Just Ask Sherry. Another video on aging because I am getting older and I am feeling it because that's what comes with age. I'm only 67, but sometimes I feel like I'm 97. Sometimes I act like I'm 12, but this is just the way it is. And I want to just talk about it a little bit today. One of my friends had hip replacement surgery this past week, and I really feel for her because I had it done 3 years ago and I know what she's going through. And it is not easy. These things that we have to have done because we're getting older, and I have a couple of old girlfriends that I don't mean chronologically old because we're all the same age, 67, but I've known them since kindergarten and I love them dearly, and we live at three opposite ends of the country and we just have always kept in touch. And it's amazing because we're three different religions and we're kind of politically different, but we love each other and we just love each other, and we just have this amazing relationship. But we share one major thing in common, in that we all have aches and pains and different body parts that are falling apart and different things that we confer upon each other, what we have going on that are hurting and aching, and we're just getting older. And you know what? We say thank God that we are still mobile and we still get up and we still are able to do our things. But, this is just life as we're getting older. And I hope you're going to share with me in your comments below what your aches and pains are and what things are going wrong with you. And hopefully we can help each other. I don't think I've ever talked about this in a previous video, but I had hip replacement 3 years ago in November. And so it's almost 3 years, and it'll be 3 years and 2 months. And one of the things that I found amazing about my hip replacement surgery is that I had it done at this hospital that's a big hospital system here. And they had me do, I think it was an hour or 2 hour long class before I was allowed to have the hip replacement. Everybody had to attend this class and sign off on it. And in this class, they told you, quote unquote, everything you needed to know about having hip replacement, what to expect, what you needed to know, what you were going to have to go through before and after the hip replacement. You had to do certain exercises every single day and sign off on those, that you did those exercises. I think it was for 2 weeks before, maybe it was a month. I don't remember because it's 3 years ago, but you had to do special exercises before you did this hip replacement surgery. And my surgeon was like, everybody recommended him. There was a few surgeons and he was one of the recommended surgeons. He did several a day. I don't know if it was 10 a day or 20 a day, but it wasn't a long surgery, and he was very highly, highly recommended for this surgery. And it was like, not outpatient at the time, although I think today it's now outpatient, but you went in, and that day they had you up and walking and climbing 3 stairs, coming back down 3 stairs. And it was just, commonplace, almost like having a tonsillectomy is today, no big deal. And, my daughter, who was a nurse at the time, now she's a nurse practitioner, but, she wanted to know what kind of material they were using, because in the, several years ago, they were using, I think it was cobalt, which was leaking and causing all kinds of crazy problems and whatever. So, she had to make sure that the material was a good material to use and blah, 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 and all of this other stuff. So I had this surgery done, and, you had to have pain meds after this surgery. It was serious. So, my husband slept in the chair next to me because I am a little afraid about being left in the hospital alone, because you have to have an advocate today. Because, especially fast forward a few years after COVID, you really have to have an advocate because there's not enough staff. I'm going to take a little break and ask you to like and subscribe to my channel so you can keep coming back and I can keep being here for you, and put your comments below and hopefully I can answer them for you. But anyway, so I had this surgery. I was able to walk right away, which I thought was pretty amazing. And I did the stairs up and down, and everything was okay, which I thought was great because I have a split level home and that I could be able to go up and sleep in my bed. Although I think the first day I came home, I slept on the couch downstairs, which is a pretty firm couch, and, in walking distance to our half bath on the main floor. And I was a little afraid to go up into my bed the first day. So I did that. and everything was good, and had my surgery. And after the surgery, when the PT came to my house for in-house therapy, I said to him when I was doing the side lifts on my leg, I said, one leg feels shorter than the other. And he said to me, it's not unusual. Sometimes it takes a while for the new leg to fit into the socket. So it might take a little while for it to set into the socket and be even. That's what he said. So I believed him, and I thought, okay, I'll give it some time because I believe everybody, because that's the way I am. I believe everybody. Until you're proved wrong, I'm going to believe you. So I waited and I waited, and he came for 6 weeks to the house for physical therapy, and that leg was still uneven. Then I went for my checkup to the surgeon's office, and I said to the PA, the physician's assistant, my leg's still not even. So she gave me this little tiny lift for my other shoe. This was my left leg that was now longer than my right leg. I had the hip replacement on my right side. She gave me this tiny little, less than 1/8 of an inch lift. It actually had 3 levels. The biggest one was 1/8 of an inch to put in my right shoe so that it would even out my legs. Even with all 3 of the levels to 1/8 of an inch, my right leg was still much shorter than my left leg. And I was walking crooked. And I'm thinking, but this is what they tell me it's supposed to be. So I don't know. I'm sorry, it was my left leg was shorter than the right leg that they put in. So I was still very uneven. This was not normal. So now I'm still walking uneven and thinking this is normal, because that's what I went. And when I went back again for another visit, he said, no, this is normal. This is the way it's supposed to be. Okay, he's one of the best surgeons in the system, and this is what he's telling me is normal, so I'm going to believe it. And then fast forward, maybe, I don't know, 6 months after my surgery, now all of a sudden, I have sciatica. And I'm in agony, and I have terrible back pain, and I'm miserable. And now I have terrible pain, and that lasts a long time, almost a year later, and I am in terrible pain. So I start seeing a chiropractor, and he says, wow, you have a really big leg difference. It's almost 1/4 of an inch. Let's see if we can fix that. And he tries adjusting me, and that doesn't help. Now I get acupuncture. Then I start reading a book called The Mind-Body Prescription, which is supposed to tell you in your mind that your pain is not, it's all in your head. But I'm grasping for straws, so I'm going to do anything I can. Then I buy an inversion table, one of these things where you can hang upside down like a bat, and hopefully it's going to stretch out your spine, give room for your discs to stretch out so that they won't be compressed. And so I'm hanging like a bat for months. Then I get vertigo, because in hanging like a bat upside down, there's this little crystal in your inner ear that when it gets displaced, like some people get it from going to the dentist and hanging upside down in the dentist chair, that crystal gets loose and it has to be put back into place. So now I've got to go to a physical therapist who specializes in putting that crystal back into place. So it just goes on and on. So I get the crystal put back into place. I don't have vertigo anymore. Then I get an MRI, and I have scoliosis and stenosis and sciatica and a herniated disc and a bulging disc. So I go see a homeopathic doctor. And the homeopathic doctor says to me, I hate to tell you, but you need surgery. Well, when a homeopathic doctor says to you, you need surgery because they don't advocate for surgery because they're homeopathics. So I went, holy moly, this is pretty serious. If he says I need surgery, I guess I need surgery because I've already done everything else. I did aquatherapy and physical therapy. I did all the therapies. And he says I need surgery. So now I go to a neurosurgeon and he said, oh, you really need surgery. So I had to have back surgery. All because the orthopedic surgeon didn't tell me that what I really should have done, and I did this actually, which helped, is I had a 1/2 inch lift done on my left shoe that would make me even when I walked. And I even have that lift on my slippers. So if you have hip replacement and you are not even, go put a lift on the shoe that needs to be evened out. And that's my best advice for today. Don't listen to that orthopedic surgeon who wants to cover his rear end or her rear end. Go get a lift put on your shoe and your slippers and your sneakers and every pair of shoes you wear. And it's not inexpensive because you have to get shoes that will take a lift. And I went to Foot Solutions and she was amazing. And I have a lift on. I don't even walk to the bathroom anymore without my slippers on. Best advice I could give you. Love you guys. Keep coming back. Like and subscribe. Just Ask Sherry. Email me at justaskSherry@gmail.com. Comment below. Keep coming back. Appreciate your time. Thank you.